The unexpected truth about eggs, a doctor's warning to seniors. When you think of a healthy breakfast, what comes to mind? Oatmeal, a smoothie, maybe a couple of eggs. Most people believe eggs are a superfood packed with protein, nutrients, and healthy fats. And they're not wrong. But here's something most doctors never say out loud. If you're over 60 and eating eggs the wrong way, you could be slowly damaging your health. Hi, I'm Dr. Harold Whitman. I've been an internal medicine specialist for more than 60 years, and at 92, I still see patients every Tuesday at a senior care center in upstate New York. People ask me all the time, how are you still practicing at your age? Well, here's the surprising answer. One of my personal health secrets is eggs. But, and this is critical, I don't eat them the way most people do. And that's what this video is about, the difference between eggs that heal and eggs that harm. So, if you're someone who eats eggs every day, and your health still seems to be going downhill, low energy, high cholesterol, or digestion issues, please watch this all the way through. What I share today could make a bigger difference than any pill in your medicine cabinet. Oh, and before we go on, tap the like and subscribe buttons. That way you won't miss the rest of this health series. One click from you could help someone else live a longer, stronger life. Let me tell you a quick story. Arthur Bell, age 83, from Chicago. Smart guy, lived alone, took pride in cooking for himself. He came to the hospital with what looked like a bad stomach bug. After some digging, we found the problem salmonella from undercooked soft-boiled eggs. He'd eaten them every day for 40 years, but recently he'd gotten lax about checking expiration dates. I've never had a problem before, he told me, but that's just it. Your body changes with age. Your immune system weakens. Your gut lining gets thinner. What used to be harmless becomes dangerous. And eggs, though nutrient-dense, contain delicate proteins and fats that interact very differently with aging bodies. In short, the way you cook and time your eggs can decide whether they work for you or against you. Now, let me give you another example, one with a happy ending. Eleanor Green, 86, from Kansas. She'd been on cholesterol meds for over 20 years. Her morning routine, fried eggs and butter, every single day, plus pills with lunch. Her energy was low. Her numbers weren't improving. She was frustrated. She told me, I feel like I'm doing everything right, but I'm getting nowhere. I asked about her egg routine, and I introduced her to what I call the senior safe egg method. It's simple, it's natural, and most importantly, it works with your aging metabolism, not against it. 3 months and her cholesterol dropped 30%. 6 months later, she cut her medication in half and told me her energy had come back for the first time in years. That's the power of tiny strategic changes, and that's what I want to give you today. Because I've seen this over and over, one small shift in the way you eat a common food can have a ripple effect on your health, energy, and independence. So, please stay with me. The next few minutes could change how you look at food and aging for good. And please don't try anything until you've watched the whole video. Skipping ahead or guessing could do more harm than good. This isn't just about eggs. It's about how your body responds to the choices you make every day. Let's get into it. These are the 6 egg-eating mistakes that could be sabotaging your health and what to do instead. Mistake number 1, turning a superfood into a daily burden, eating too many eggs. There's an old saying that still holds true today. Too much of a good thing can become a bad thing. Eggs are incredibly nutritious, no one's disputing that. But that doesn't mean you can eat 3 or 4 of them every day and assume you're nourishing your body. In fact, when it comes to eggs, more isn't always better, especially as we age. In my career, I've met many older patients who treat eggs almost like a miracle cure. They believe eating more eggs equals better strength, better memory, better health. But when their lab results show elevated cholesterol, liver enzymes, and blood pressure, they start to wonder, could it really be the eggs? Let me share a case that stands out. The case of Mrs. Hurst and her 4-egg-a-day habit. Mrs. Margaret Hurst, 77, lives just outside St. Louis with her husband and 2 young grandchildren. Every morning, she'd start her day with 2 boiled eggs. At lunch, she'd add another. And by dinner, she'd fry 1 more to eat with rice. Her logic, I read, that eggs help preserve muscle support memory, and they're easy to digest, so the more the better. But after nearly a year of this routine, Margaret began noticing troubling symptoms. difficulty sleeping, especially at night, mild swelling in her hands and feet in the morning, fatigue and dizziness, blood pressure that bounced unpredictably from low to high. Her blood work confirmed what her body was trying to tell her. Her liver enzymes had doubled, her triglycerides were up, and early signs of kidney strain were beginning to show. The culprit: too many eggs. Why too many eggs can harm. Older adults. 1. Hidden cholesterol. Overload. A single egg contains around 186 mg of cholesterol, nearly all of it in the yolk. While some studies show that dietary cholesterol doesn't severely impact young, healthy people, older adults, especially those with heart issues, diabetes, or hypertension, are much more sensitive. If you're eating 3 to 4 eggs a day, you could be consuming up to 700 mg of cholesterol daily, more than double the recommended amount. 2. Extra strain on liver and kidneys. Eggs are high in protein, which is essential, yes, but too much protein becomes a burden on aging organs. Your liver must work harder to process excess protein, and your kidneys are responsible for filtering out the byproducts, urea, creatinine, and ammonia. As these levels rise, older adults can experience fatigue, itchy skin, high blood urea nitrogen, and in prolonged cases, chronic kidney damage. 3. Greater risk of artery damage and stroke. Cholesterol buildup doesn't happen overnight, but over time, excess cholesterol can harden into plaque along artery walls. This leads to reduced blood flow to the brain, chest tightness, and shortness of breath. Increased risk of stroke, especially in people with atrial fibrillation or high blood pressure. So, how many eggs are safe for most healthy seniors? 1 egg per day is generally safe and beneficial. For those with cardiovascular risk, diabetes, or high cholesterol, 3 best 4 eggs per week is a more cautious approach. If you already get plenty of protein from meat, poultry, or fish, consider limiting eggs to 2 to 3 per week to avoid overloading your liver and kidneys. Pro tip: take egg rest days. Don't eat eggs every single day. Give your body space to reset and process. Warning: signs you may be eating too many eggs. If any of these symptoms sound familiar, your egg intake may be worth reviewing. Bloating or indigestion, especially after breakfast. Frequent burping or acid reflux. Persistent fatigue even after a full night's sleep. Difficulty falling asleep or waking, often during the night. Mild increases in liver enzymes or trouble controlling your blood pressure. If you're noticing any of these signs, or if your egg habit has become daily and repetitive, take a moment to reassess. A small reduction might make a big difference for your heart, liver, kidneys, and overall energy. Mistake number 2. Eating only. Egg whites on an empty stomach. Next up is a mistake I see far too often, one that stems not from ignorance, but from good intentions, gone slightly off track. Eating only egg whites, especially on an empty stomach. Many seniors concerned about cholesterol have gotten into the habit of tossing out the yolk and sticking to the white. It sounds like the smart thing to do, doesn't it? Less fat, less cholesterol. What could go wrong? Well, more than you might think. Egg whites, while a solid source of protein, contain a compound called avidin. And this substance has a tricky side. Avidin binds to biotin, vitamin B7, a nutrient that plays a critical role in your body's ability to produce energy, maintain healthy nerves, support mental focus, and keep your skin and hair in good condition. When you eat only the whites, especially first thing in the morning, when your stomach acid is at its peak, avidin can significantly reduce your body's ability to absorb biotin. Over time, this can lead to subtle but serious problems. Chronic fatigue, tingling, or numbness in your hands and feet, muscle weakness, brain fog, and in some cases even symptoms of depression. I remember one patient, Mrs. Laura Mitchell, age 80, who came to see me because she was struggling with extreme tiredness and strange nerve sensations in her fingertips. She had no idea that her clean breakfast of plain egg whites every morning was quietly contributing to her discomfort. Once we reintroduced whole eggs into her diet, eaten with food instead of on an empty stomach, her energy levels rebounded and the tingling eased. You see, nature packaged the egg perfectly. The yolk isn't the villain. It's the source of some of the most valuable nutrients eggs have to offer. Inside that golden center, you'll find not only biotin, but lecithin for brain health, omega-3 fatty acids for heart and joint support, and eye-protecting antioxidants like lutein and zeaxanthin. By discarding the yolk, you're not just avoiding cholesterol, you're also discarding many of the nutrients your body needs more of as you age. And it's not just about what you eat, but how and when. Eating eggs on an empty stomach not only amplifies avidin's biotin-blocking effect, but also puts strain on your digestive system. A much gentler, more beneficial approach is to enjoy eggs as part of a balanced meal with whole grain toast, a side of vegetables, or even just a piece of fruit. This slows digestion, improves absorption, and helps keep your blood sugar and energy stable throughout the day. Now, I know cholesterol is a concern for many, and rightly so. But studies now show that for most seniors, one whole egg a day, 5 to 7 per week, is perfectly safe and, in fact, beneficial when consumed thoughtfully and as part of a balanced diet. And if you're on cholesterol medication, you don't have to avoid eggs entirely, but you should absolutely talk to your doctor about the best timing and quantity for your unique situation. It's remarkable how often people make small changes with the best of intentions only to find they've been missing the very nutrients that keep their minds sharp and bodies strong. So if you've been tossing the yolk and eating your eggs solo at sunrise, maybe it's time to welcome the yolk back to your plate and give your breakfast a bit more balance. Mistake number 2, eating raw or undercooked eggs. Now, let's talk about another habit I've seen far too often among seniors: eating raw or undercooked eggs. It's a tradition for some, cracking a raw egg into a glass of milk or juice, or enjoying soft-boiled eggs with a runny center. I even had a patient who mixed raw eggs with vodka every morning, believing it gave him strength. It might sound old-fashioned, but unfortunately this seemingly harmless habit can carry serious and sometimes life-threatening consequences. You see, raw eggs come with a very real risk of salmonella contamination. For someone in their 20s or 30s, a mild stomach bug might be all they experience. But for seniors, it's an entirely different story. The immune system becomes less responsive with age. Infections that once resolved in a few days can now turn into dangerous conditions like severe dehydration, high fever, or even sepsis, which is a life-threatening reaction that can lead to organ failure. I still remember one of my longtime patients, Mr. Mark Thompson, who ended up in the ICU after drinking raw eggs with vodka, a daily ritual he had kept up since his youth. The salmonella infection spread quickly through his weakened immune system, and while we managed to stabilize him, he required weeks of hospitalization and strong antibiotics. His gut microbiome was thrown into chaos, leaving him with chronic digestive issues and malnutrition that lasted for months. But the trouble with raw eggs doesn't end at foodborne illness. Even if you never get sick, your body still pays a price. Just like in our first mistake, raw egg whites contain avidin, a compound that binds tightly to biotin or vitamin B7. The difference is when eggs are raw, avidin remains completely active and prevents your body from absorbing this crucial nutrient. And biotin isn't something you want to go without. It supports energy levels, nerve, health, brain function, and even your mood. Worse still, raw eggs can disrupt your gut's delicate balance. Raw egg proteins interfere with beneficial bacteria, which your body relies on, not just for digestion, but for immune function, inflammation control, and mental health. More and more studies are confirming the link between gut health and age-related diseases like Alzheimer's and Parkinson's. So, eating raw eggs regularly doesn't just increase your risk of food poisoning, it may be undermining your brain, your immune system, and your long-term resilience. That's why I always recommend cooking your eggs thoroughly. Boil them for at least 9 to 12 minutes until the yolk is fully set and safe to eat. If you prefer scrambled or fried eggs, make sure they're cooked all the way through and avoid runny centers. Stay away from cracked or dirty eggshells, and never take a chance on eggs that are past their expiration date, no matter how discounted they might be at the store. I know many people associate soft-boiled or raw eggs with tradition, or think they're somehow more nutritious, but those beliefs are outdated and dangerous when you're older. Remember, it's not just about eating healthy foods. It's about eating them in ways that support your body as it is today, not as it used to be. Mistake number 3. Eating eggs together with medication. Now, let's move on to a mistake that many seniors don't even realize they're making eating eggs too close to when they take their medications. It sounds harmless enough, right? A nice breakfast with your pills, maybe a cup of tea, and a couple of eggs. But over the years, I've seen this routine quietly interfere with treatment outcomes again and again. You see, eggs aren't just a source of protein. They're also rich in vitamins and minerals that can interact with certain medications in ways that reduce their effectiveness, or worse, create unintended side effects. This is especially true if you're on medications like blood thinners, antibiotics, iron supplements, or thyroid medications, all common among older adults. Let me give you an example. One of my patients, Mr. Walter Green, 85, was taking a blood thinner called warfarin after a mild stroke. He was doing well, but one morning he came into the clinic with severe nosebleeds and signs of internal bleeding. After some digging, we discovered he'd recently started eating eggs every morning, 2 of them fried with toast, right around the same time he took his medication. What he didn't know was that egg yolks are rich in vitamin K, a nutrient that can directly interfere with how warfarin works, making it less effective or too effective, depending on how consistently it's consumed. And the issue isn't limited to blood thinners. Antibiotics like tetracycline and quinolones can bind to the calcium and magnesium in eggs, reducing their absorption and delaying your recovery. Iron supplements, which many seniors take for anemia, can also get trapped by proteins in egg whites, forming complexes that pass through your system without being absorbed. That means you may think you're treating your condition, but your body isn't getting the nutrients or medications it needs. This exact scenario played out with another patient, Mrs. Helen Brooks, 76, who had been struggling with persistent fatigue and low iron levels, despite faithfully taking her supplements. It wasn't until we separated her egg consumption from her medication times that we saw real improvement. Within weeks, her iron levels rose and her energy slowly returned. What's more, certain medications like levothyroxine for thyroid function are best absorbed on an empty stomach. But if you follow them immediately with a breakfast of eggs, toast, and coffee, you're likely undoing the effect of that pill. The same goes for calcium and zinc supplements, which are both critical for aging bones and immune strength. If you wash them down with a bite of omelet, you're getting only a fraction of what you think. The good news is, this is a simple fix. Just space your egg-based meals at least 2 to 4 hours away from your medications, especially if they fall into any of the categories I mentioned. That small adjustment can make a world of difference in how well your body absorbs both the nutrients from food and the medicine that's meant to support your health. It's easy to overlook the timing of meals and pills, especially when habits have formed over years. But as I always tell my patients, medicine doesn't work in isolation, it works in context. And food is a big part of that context. So, if you've been pairing your pills with your eggs, it might be time to break up that breakfast combo for the sake of your health. Mistake, now starts to 4. Eating eggs too early in the morning, between 6 and 8 a.m. Let's talk about timing, because when you eat eggs can be just as important as how you eat them. Many people, especially older adults, have a well-established morning routine that starts at dawn. Wake up, take a brisk walk, make a cup of tea or coffee, and fry up some eggs by 6:30 a.m. It feels productive, wholesome, and healthy. But if you're eating eggs during the early morning window, you may be unintentionally raising your cholesterol levels and stressing your digestion. Here's why that happens. Every morning, like clockwork, your body releases a hormone called cortisol. It's often labeled the stress hormone, but it actually plays a natural and essential role in regulating your daily rhythms, blood sugar levels, blood pressure, and yes, even cholesterol production. The problem is that cortisol peaks between 6 and 8 a.m., and one of its lesser-known effects is that it stimulates your liver to produce more cholesterol. So, what happens when you eat eggs, especially fried eggs during this window? You're giving your liver a double message: make cholesterol. And here's some more. The result can be a significant spike in cholesterol levels, especially for older adults whose metabolic processes are already slower and more sensitive. One patient, Mr. Leonard Chase, 78, had been eating 2 fried eggs every morning at precisely 6:15 a.m. for decades. He believed in starting his day with protein and would never skip his routine. But after a mild heart attack sent him to our clinic, We discovered his cholesterol levels were almost twice the healthy range despite taking statins and eating what he thought was a clean diet. The culprit, that early morning egg habit. But it doesn't stop at cholesterol. Your digestive system isn't fully awake first thing in the morning. The gut has been resting overnight and needs time to re-engage. Eggs, while wonderfully nutritious, are also high in protein and fat, both of which take more effort to digest. Eating them too early can lead to indigestion, bloating, acid reflux, and a sluggish start to your day. This is why I often recommend a simple shift. Wait until mid-afternoon to enjoy your eggs specifically between 2 hours and 4 hours p.m. By this time, cortisol levels have dropped. The digestive system is fully active, and the body is in a better position to metabolize cholesterol and absorb nutrients efficiently. In fact, this is when your liver is most effective at clearing excess cholesterol from the bloodstream, not producing more of it. And if you want to maximize the benefit, pair your eggs with fiber-rich vegetables like spinach, broccoli, or onions. Not only do they enhance digestion and help regulate blood sugar, but they also contain antioxidants that protect your arteries and reduce inflammation, a perfect nutritional team-up for heart and brain health. I understand the comfort of a familiar morning routine, but sometimes a small shift like moving your eggs from breakfast to lunch or an afternoon snack can have a huge impact on your overall health. You're not giving up eggs, you're simply giving your body a better chance to use them well. Mistake number 5, cooking eggs at high temperatures, especially frying. Now, let's turn to something that may seem minor, but can make a major difference how you cook your eggs. If your go-to method involves tossing eggs into a hot, oily pan and letting them sizzle until the edges turn crispy brown, you're not alone. It's a common, tasty, and fast way to cook. But if you're in your senior years, frying eggs at high temperatures might be doing more harm than good, quietly undermining your digestion, your nutrient absorption, and even your brain health. Here's what happens when you cook eggs in high-temperature oil. First, egg proteins are delicate by nature. When exposed to intense heat, especially above 212 degrees on 100 degrees Fahrenheit, they become denatured, which means their structure changes so drastically that your digestive enzymes have trouble breaking them down. For younger individuals with strong stomach acid and robust digestive systems, this might not be a big deal, but for older adults with weakened gastric function, this protein breakdown can lead to indigestion, bloating, heartburn, and even loss of appetite. But the heat doesn't just affect the eggs, it also transforms the oil. When cooking oils reach their smoke point, they begin producing harmful byproducts like aldehydes and acrolein chemicals that are toxic, pro-inflammatory, and associated with oxidative stress. Over time, regular exposure to these compounds can irritate the stomach lining, worsen chronic inflammation, and even contribute to long-term disease risk. One case that stands out in my memory is Mrs. Ruth Delaney, age 84, who came to me complaining of persistent stomach discomfort. She had lost weight, struggled to eat full meals, and felt tired all the time. After ruling out ulcers and infection, we examined her diet. She had been frying eggs every morning in vegetable oil. When we switched her to gently boiled or poached eggs, her symptoms improved within weeks. What she had assumed was just old age digestion turned out to be a simple issue of cooking method. And beyond digestion, there's an even greater loss hidden in that frying pan: choline, a nutrient found primarily in egg yolks and critical for memory, cognitive function, and brain health. High heat destroys choline, quickly robbing your brain of a tool it desperately needs, especially if you're trying to stay sharp into your 70s, 80s, and 90s. That's why I always recommend cooking methods that preserve the nutritional integrity of the egg. Boiling eggs slowly in cold water for about 10 minutes allows the protein to set without damaging its structure. Poaching, gently cooking the egg in simmering water, or steaming are also excellent options. These low-temperature techniques not only make digestion easier, but also retain more vitamins, antioxidants, and brain-boosting compounds. And please avoid using the microwave. While it may be convenient, microwaving causes uneven heating, rapidly denaturing some parts of the egg while undercooking others. Not to mention the risk of the egg exploding, which is both messy and dangerous. If you still want to enhance the flavor, consider seasoning your eggs with herbs and spices that support digestion and reduce inflammation. Turmeric, parsley, black pepper. These aren't just tasty. They can help your body process protein more gently and even support brain health. Turmeric, in particular, contains curcumin, a powerful antioxidant known for its anti-inflammatory and neuroprotective effects. So, if you've been frying your eggs on high heat every morning for years, now might be the perfect time to try something gentler. Your stomach will thank you, your brain will thank you, and your long-term health may improve more than you think. Conclusion: a small change that could add years to your life. So there you have it, 5 simple but critical mistakes that many seniors make when eating eggs. None of these errors come from bad intentions. Quite the opposite, most of my patients who fell into these habits were trying their best to eat healthy, to stay active, to do what they had always done. But what we must remember as we age is your body is not the same at 70 or 80 as it was at 40. The rules change, and that includes how your body responds to even the most familiar foods. Eggs are without question one of the most nutrient-dense and affordable foods available. They are a rich source of high-quality protein choline, vitamin D, B, vitamins, selenium, and more. But as I've said many times in my practice, and I'll say it again here, a good food eaten the wrong way can become a bad food. The line between medicine and poison isn't always what's on your plate, it's how, when, and with what you eat it. Let's quickly review. Don't eat egg whites alone, especially on an empty stomach. Eat the yolk too. Avoid raw or undercooked eggs, always cook them thoroughly. Don't mix eggs with medication, give a safe 2 to 4 hour gap. Avoid early morning egg meals, choose mid-afternoon instead. Say no to high heat frying, boil, poach, or steam your eggs gently. If you follow these 5 principles, you'll not only avoid the hidden risks, but you'll unlock the full potential of eggs as a superfood for your golden years, a source of strength, clarity, and resilience. You don't have to change everything overnight. In fact, you shouldn't. Sustainable health doesn't come from dramatic overhauls. It comes from small, thoughtful adjustments that build momentum over time. If all you do tomorrow is boil your egg instead of frying it, or move it to lunchtime instead of breakfast, you're already taking a meaningful step toward better health. At 92, I'm still practicing medicine, not because of one big secret, but because of dozens of small choices I've made consistently over time. Choosing when I eat eggs, how I cook them, what I pair them with. These things matter, and they compound just like interest in a savings account. So, I invite you to pick just one idea from today's guide and put it into practice. Try boiling your eggs, eat them with vegetables. Talk to your doctor about timing with your meds. Share what you've learned with your spouse or a friend. These aren't just tips, they're tools to help you live not just longer, but better. Thank you for spending this time with me today. If you found this helpful, I encourage you to share it with someone you care about. A single conversation can change a life. And don't forget to subscribe, because in our next session, I'll be sharing 6 foods every senior should add to their diet, starting this week, and why they may be even more powerful than supplements. Until then, stay curious, stay kind to your body, and remember, you're never too old to make a smart, healthy change. I'm rooting for you every step of the way.